Of the coronavirus in our state have tripled in less than a week. The governor wants to make it very clear. This virus doesn't just affect the old. 1/4 of people hospitalized are under the age of 50. Of the 416 people hospitalized with coronavirus right now, more than 40% are in intensive care. More than 2,700 have tested positive in Maryland, and we know 42 have lost their lives. There are more than a dozen cases in Maryland correctional facilities, including several officers, and there are outbreak clusters at 60 nursing homes and long-term care facilities. WJZ investigator Mike Helgren has the latest.
We now have widespread community transmission. This virus is everywhere, and it is a threat to nearly everyone.
Maryland has not yet flattened the curve. This new chart from the state shows the continuing rise in cases. The state recorded 2,758 cases and 42 deaths.
Sadly, we have 5 infants who have been infected, including a one-month-old. The reality is that this disease does not discriminate.
The governor revealed there are now cases at 60 Maryland nursing homes and long-term care facilities.
What we are seeing here in Maryland and across the country is clear evidence that people can be infectious, that they can transmit this virus even before they develop symptoms.
And the deputy health secretary announced workers at these facilities must wear masks.
The masks must be on to intercept that transmission.
The son of a nurse at Future Care Canton Harbor tweeted a letter this week to the governor. He worries about his mom. She told us initially she was instructed not to wear a mask and protective gear was in short supply. Future Care, which has confirmed cases at 2 other Baltimore facilities, says they are following state guidelines and the safety and well-being of staff is their primary concern. Do you feel safe when you go to work?
I don't. The mask is not enough. It's just scary. You don't know each day what's going to happen.
And corrections officials confirmed 17 cases in Maryland's prison system, including 3 inmates and 4 officers.
We've required temperature checks and health checks for all of our staff at every entry point into our facility.
Governor Hogan also announced an executive order to temporarily stop foreclosures and repossessions.
We're also facing another huge battle against catastrophic economic collapse.
The governor also said initial construction for a makeshift hospital at the Baltimore City Convention Center has been completed. He wants people to pause on Sunday at noon for a moment of prayer and reflection to remember those who've died, those who are sick, and those still working on the front lines to fight this illness. In North Baltimore, Mike Helgren, WJZ.
A short time after Governor Hogan updated the state on the coronavirus situation, Baltimore Mayor Jack Young did the same regarding the city. Here's what he had to say.
Since Wednesday, April the 1st, we have seen a 42% increase in confirmed COVID-19 cases here in Baltimore City. The data that I will provide is official data that we get from the state. As of this morning, the city has 313 reported cases, 145 people hospitalized with COVID-19, and 4 deaths.
Meantime, the parking lot at Pimlico will become the next drive-through coronavirus testing site. Mayor Young made the announcement and says it was selected because of its accessibility. The National Guard is assisting with the site. It's unclear when it will open. The Harford County Sheriff's Office announced its first case of COVID-19. Officials say a supervisor assigned to the Investigative Service Bureau has tested positive. The deputy was last at work on March 26th and was non-symptomatic. The Sheriff's Office says they are working to determine which staff and personnel may have potentially been exposed. The deputy is said to be feeling better and is expected to make a full recovery. Well, it's a question many have been asking. Should you wear a mask the next time you head out in public? Well, now the CDC is recommending all Americans cover their faces in public to help stop the spread of the virus. But the president says it is voluntary and he will not be following it. Stetson Miller has the details.
The CDC is now recommending Americans wear masks to stop the spread of COVID-19. President Trump announced the revised guideline Friday. Still, the president said he can't see himself wearing a mask.
You can do it. You don't have to do it. I'm choosing not to do it, but some people may want to do it, and that's okay. It may be good. Probably will. They're making a recommendation. It's only a recommendation. It's voluntary.
The agency advises using non-medical cloth since many masks are in short supply and healthcare professionals need them. In New York, Mayor Bill de Blasio is also on board.
We're advising New Yorkers to wear a face covering when you go outside and will be near other people.
The recommendation comes after evidence showing infected people without symptoms can still spread the virus.
Here's what we're talking about: masks. Masks are not to protect you from incoming virus. Masks are to protect everyone around you.
It's a stark difference from previous guidance saying healthy people don't need masks. Nonetheless, many already had started wearing them.
When I get in a crowd of people that I can't, like the buses or something that I can't help, I smack on a mask.
Northwest Hospital Medical Staff President Jeanette Linder says that even if you are wearing a mask, it doesn't mean you should stop following other guidelines.
Is wearing a mask and gloves enough? No, it's not. You need to stay home.
And the key here is to remember that these masks are not a replacement for social distancing. You still need to maintain at least 6 feet between people. In North Baltimore, Stetson Miller for WJZ.
And you can stay with WJZ as we continue to follow the newest developments in the coronavirus pandemic, both on air and online. We have everything you need to know posted right now at WJZ.com.